Hey everyone! I know this is a little bit later than it usually is in the beginning of the week, but I was actually in Canton, Texas at a cancer retreat. Um, and so it was really nice and healing for a lot of, to be around people that were in similar situations. So it's really good and really educational, but I am not here to talk about that. I'm here to talk about what it's like to get your first treatment, going to that first appointment, and all of that. So after you and your team have decided what chemo regimen you will be on, because every diagnosis is different, every diagnosis, every cancer is different. So you could just get a couple hours one day and go back again the next week. You could go once a month. For me specifically, I would spend about 8 to 10 hours in infusion the first day. They would hook me up to what is called a pump. What is my dog eating? Whatever. Um, and you would take that home, and it's like a little pump, like contraptions, like this little guy. And then you get a little chemo bag, and they stuff it in like a fanny pack, or you can get they make bags for this reason. So it's pretty cool. Um, so James actually bought me a few, and then we donated the rest um, to the cancer center. But anyways, I bring it home, and it pumps continuously for 46 hours. And so if I went on a Monday, I would spend 8 to 10 hours there, and then get the pump connected, go home all day Tuesday, and then Wednesday, first thing in the morning, we would drive back out to about 2 hours away, and then I would get disconnected and spend another hour to 2 hours in infusion again, getting hydrated because I would be just dehydrated and try to stay ahead because when you're on chemo, you don't want to ingest anything typically. And then I would get what's called an on-body shot on Neulasta, and we would call it the turtle. It's this little guy, and we would just put it on the back of my arm. And 27 hours after chemo, it would inject me, and it basically would keep my white blood cell count up. So that's kind of my infusion routine for about a year. But anyway, so you go to your first day of infusion, and typically you go to what's called chemo education, which is exactly what it sounds like. You sit down in this small room and you get educated on the chemo that you're about to start. And if that isn't enough to make you crap your pants right before you're going to go into this poisoning, essentially, I don't know what is. So they go, if you have more than one drug, chemo medicine, they go through it and they give you a packet, and it has what it is, what it does, sometimes how it was developed, and then the long, never-ending list of side effects, which at the end they also tell you these aren't the only side effects possible, like as if the 50 that you have listed wasn't enough. So thanks, I'm really looking forward to my big toe falling off or whatever. It's ridiculous. So as you go in there and they give you this long, long list of side effects, they're like, oh, but we have medicine, that can make it more comfortable. Well, great. So I'm already on 6 drugs for chemo, but you want to put more in me before I get those chemo drugs? Thanks, guys. And a lot of the times they hadn't helped me. Like, I suffered from nausea so bad that nothing helped. Like, even the patches that they say last 3 days or the medicine that they give you through infusion, no, nothing helped me. So you have the education, and I never had to have radiation. I've never gone down that path, so I apologize that I'm not able to help in that area. But I have been told that radiation works similarly. You kind of have like an education, and then you go in. And some people get tattoos, like like 3 dots. I don't know if you've seen like people have the 3 dots on their hand, but like wherever they're getting radiation, they get it tattooed so that way they know where to put the laser or whatever it's called each time. Um, so that's just interesting to me. But I don't know much beyond that, so I apologize. If anyone does need me to find more information on it, just let me know and I can definitely do that. Um, so, what were you doing? Anyways, so you are done with education and you go into the infusion room, which for me was the first time I've ever gone into the infusion room. And you see on movies or TVs, or you have your own opinion or expectation of what it's going to be like. And so you just walk into this room, and it's like the one I went to down was just rows of infusion chairs and then people in them, and they looked sick. And talk about a type of culture shock, I guess. I don't know if culture is the right word, but it's intimidating. You're like, just all these people just look so miserable, because who wants to sit in a freaking chair getting pumped full of chemo for more than 5 hours? Like, no one in their right mind. Um, so I'm in there, I'm 24 years old, and I'm about 22 weeks pregnant at this point. And of course, anyone walks through a door in any room, if you're infusion room, hospital, I don't know, a restaurant, you always turn to look, typically. And so that's exactly what happened. They turned and looked, and then it was a bunch of double takes because of my age, and I'm pregnant. So that's a little intimidating. I was the youngest one in there and the only one pregnant in there. I guess thankfully, because no, I wouldn't want anyone else in that situation. And so I'm sitting there in the chair, and this nurse walks up, and she is by far my most favorite nurse that I've had. One of my most favorite. I can't say the only favorite. I've had a lot of amazing nurses. But she had different colors in her hair. She was very fun and bubbly, and exactly, I think, what an infusion room would need. And she was like, hi, and she said her name, and she had a student with her, and she introduced the student, and she's like, okay, we're going to start your port. And I don't think I showed, but right here's where I had my port. I don't have it anymore. But it's a catheter that they put in, and it goes up, and you used to be able to see it, and then it go around into, kind of like the PICC line I mentioned in a couple videos ago. It goes into a main artery, because if you put it in your arm, it'll just disintegrate the veins, and yeah, obviously it's not good, right? Anyway, so she's like, we're here to access your port and get your pre-meds going, and pre-meds are, sorry, my nose is running. Pre-meds are if you have an allergic reaction, and they know that, they'll give you Benadryl. I didn't need that, and I didn't want it. Some people get steroids to protect your organs. I didn't get it. I don't know that I didn't need it because of my specific chemo, but I didn't get it. The anti-nausea medicine, they have fluids going, and I know they would do one more. I don't know. I had a lot. I don't remember everything. But that's when you have about an hour and a half before your actual chemo medicine that you would be in the infusion room getting pre-meds. And so when she told me that, I looked at her, I was like, now? And she's like, yeah, we're going to start your chemo. I was like, right now. Like, right now. She's like, yeah. She goes, is that okay? I'm like, well, do I have an option? Which I guess technically I did, right? I can deny chemo, but that was not an option. So no, I didn't have an option. And she was like, do you need a minute? And I was like, no, I'm good. And then tears started forming in my eyes, and she could see it. And she goes, do you need a hug? And I was like, no, because I'll start crying. And it was just very sweet of her because she was very genuine. She was just like, do you want a minute? I could give you a hug. And I was like, no, let's just do it. And so she accessed my port, and it's easier than having an IV because it's not a matter of like finding the vein. It's just a matter of getting the needle in between this little section. I wish I had a picture. I'll look for it while I'm talking. In this little section that just goes straight into the vein. And so it's a lot easier than getting a blood draw, but it's kind of painful because they're sticking a needle in your skin and it bruises. Yeah, and then it bleeds, and it's just not a fun thing. So yeah, so I was like, okay, let's just do it. Oh, here we go. Oh, that's not a really good picture. Okay, here's like a drawing of it. Oh, good job, Riley. Okay, so it's under the skin in the chest, and that's a needle. And this is typically what it looks like. Oh, that reflection is just so crappy. Hold on. Let me figure out my life. There we go. You can kind of see it's like a bump. And you can almost see the line going up. So yeah, that's how they put in chemo. So anyways, so she accessed it. And she was like, we're going to start the fluids going. And I was like, okay. And then we get through that, and she was like, okay, this is your chemo. And they have to wear these yellow gowns, these gloves, these masks, these hats, like hazmat suits. And then you're just in there in normal clothes, like I dress comfortably, and you're going to put that inside of me and my veins, but you have to dress for a freaking chemical warfare just to hook it up to the IV. You're not even coming in contact. Like, if that doesn't give you the warm and fuzzies, I don't know what will. So you have no idea what to expect the first time you're in infusion. And so you're just sitting there wondering, like, what side effects am I going to have? Am I going to throw up right away? Everyone's like, is my hair going to fall out right away? Like, what is going to happen? And I felt nothing. The first 4 treatments while I was pregnant, a breeze. I had cold sensitivity and neuropathy, which, for those of you that don't know, the neuropathy is a lot of diabetes patients suffer from it. They just lose feeling in their hands and feet. And sometimes it can be painful, like, you know, when your hand or feet fall asleep and you get, like, when it's starting to come back and it's really bad. And it's like those pins and needles, like, poking, and you're just like, oh my God, hurry up. It's permanently like that. And there's medications out there that can kind of help, but I've never taken them, so I don't have firsthand experience on that. I was prescribed it, I just didn't take them. My neuropathy is I just don't feel the tips of my toes. And sometimes, like, my ankles and calves will feel swollen. They don't look swollen, they just are just tired after a long day. And then my hands, if I hold something cold, it hurts. That's where the cold sensitivity comes in. I still get, like, pins and needles from the cold, or when you would drink something cold on treatment or for a couple days after, it would feel like your throat's closing up, and it would feel like you're swallowing shards of glass. But it's not like your throat was really closed. It was just how it felt, because it's oxaliplatin was one of the drugs I was on. It's a platinum-based drug. So, and that's just a side effect of that, is nerve damage. So yeah, I did so once the initial shock, I think is a safe word to say, shock is over, you kind of know what to expect. You feel a little bit more comfortable, and that sounds kind of weird, I think, saying that you're comfortable going into infusion, but you get to really know these nurses. Some people are on the same schedule as you, and you get to make friends with them. Since once I had my daughter, they put us in a room by ourselves where a lot of, like, bone marrow transplant patients, a lot of really sick patients would go. And if they had availability, they would let us go back there, because unless you're a pediatric patient, you weren't allowed to have kids back there. But we had awesome nurses that, you know, she was born with this and are, like, into this situation, my daughter. So she allowed us to keep her coming in. And unfortunately, I say that we spent a lot of time in infusion, and she learned, like, how to stand, started taking her first steps. And so she grew up in infusion, but she had a lot of loving nurses around her, so I wouldn't have it any other way. And I already talked about, like, the looks in infusion that you get from people being new, but don't let that throw you off, because those are some of the most, like, welcoming people, because they know, they've been where you're at. They know what you're feeling, what you're thinking, and that it is scary and intimidating. So if you're up for it, you know, while on infusion, and they're up for it, try to make some friends, talk to them, just wave and say hi. I would honestly say the most difficult part through the infusion was there wasn't a separate pediatric infusion room. So I did eventually see some pediatric patients walking around with their poor access, walking around their line, because you have your IVs on a line and you have to wheel it around just like you see on movies. And this little kid was just walking around with his thumbs up and waving at everybody, and he was just so full of life. And I was so angry that he was going through that. And I'm sure people were angry that I was pregnant going through what I was going through, but it's just, it shouldn't even exist. And I'm sure a lot of people agree. Not only should cancer just not exist, but if we had to choose, pediatric cancer should just not be a thing, in my opinion. But today's a little bit shorter video. I'm trying to keep them a little shorter because not a lot of people have a lot of time to listen to me just babble. So let me see what I'm going to talk about next week. So it looks like I'm going to go into like how it is during treatment as far as your friendships, relationships, if your parents or you have children, working, hanging out, keeping a consistent or having a consistent routine, and kind of how that goes and how you might need a break or you know, blood work and all that. We'll kind of go into the semantics of things a little bit, but I hope you guys got something out of this video as well, and I look forward to hearing any input or anything that you guys have, and I will see you guys next week.